The United States healthcare industry is confronting a troubling diagnosis. More and more people need healthcare as the U.S. population skews older. Meanwhile, the Association of American Medical Colleges estimates that the U.S. can see a shortage of between 37,800 and 124,000 physicians by 2034, with shortfalls in both primary and specialty care. The U.S. Bureau of Labor Statistics projects that more than 275,000 additional nurses will be needed from 2020 to 2030. These staffing shortages are exacerbated by industry trends that make it harder for organizations to compete for both talent and patients. Historically, individuals have been able to consume healthcare with little regard for the cost, since the vast majority was covered and paid for by their insurer. People are more active as healthcare consumers. Traditional medical institutions are being pushed to compete on experience, quality, cost, and the convenience of healthcare sites and services. Personalization is evident when empowered healthcare workers exited their jobs owing to pandemic stressors, low pay, inflexible work schedules, or desire for more opportunity. Healthcare organizations struggle to keep both staff and patients in an era when both populations expect more personalized approaches to their care and to their careers. Therefore, a top priority for hospital healthcare leadership is the need to provide a much more personalized experience for its leaders and staff and for its patients and community served. Here are 5 statements along with the elements of dignity they may relate to. 1. Individuals have value. They want to be included. The elements of dignity include inclusion and acknowledgement. 2. Individuals are worthy. They want to be seen in their full humanity. Acceptance, understanding. 3. Individuals are unique. They want to be themselves. Recognition, fairness, and safety. 4. Individuals have experience and insight. They want to do more. Benefit of the doubt. And 5. Individuals have ideas. They want to explore their possibility. Independence. A personalization pursuits focuses on 3 audiences. 1. Do leaders and physicians have what they need? 2. Do employees have what they need? And 3. Do patients have what they need? To be well equipped for personalization for any of these audiences does not mean personalization has been achieved and the process is complete. In fact, the act of adapting is a continuous process. So Scott, give me your response to the following statement. Without strategy, change is merely substitution, not evolution.
It couldn't be more right. Strategy is really what drives action. And we have to, we're in an interesting place in healthcare, especially from a leadership perspective. We're sort of in this parallel process of optimizing our current state. Our current state is somewhat broken. So we're in a parallel state where we're optimizing our current state, but at the same time, there's a need to innovate for the future state. And I say that purposely in that that's not a linear process. It's not sequential. It is intentionally parallel because we have to address the immediacy of some of the issues we're facing today with quality, with safety, with patient experience. There are times where you could be in a organization where you have 3 or even 4 generations of people working in that organization, serving a common good. But I think if our leaders don't lead with the desire to leave a legacy, with the desire to be a mentor, to be generous with their leadership, there's going to be a gap in our future leaders when you bring like-minded people together who have the passion, who have that entrepreneurial spirit, who have that desire to leave a mark on the future of their industry and their service. That's where a movement really begins, and that's where true transformation can take place. So again, we're here because of you, and I hope and I'm looking forward to that this is just the beginning of these discussions.
Well, that's the goal. And believe me, you and I are going to be talking, and there's going to be so much more. And Scott, again, thank you so much for your valuable time. It's really been a pleasure. Thank you. You're an inspiration, Scott.
Pleasure's all mine. Thank you, Glenn. Have a great day.
Okay, you too, Scott. Thank you so much. Well, as we end the 2024 Healthcare in the Age of Personalization Virtual Summit, what do I walk away with? Number one, we care. Everybody here came together because we care. We're looking for what the opportunities are. Two, we love. We love what we do. And we love the people we do it for. And we love the people that we work with to get us to where we want to go. And without that, nothing else can really happen if we don't love what we do and love those we lead. But as I always end every episode, every summit, every time I speak, it's that when you lead in the age of personalization, you will see things that others don't, do what others won't, and keep pushing when prudence says quit.